Good afternoon. My name is Trevor Layden.
I'm Anthony Herman.
I'm Steve Sanko.
And I'm Bryce Evil.
We're going to talk about the middle cerebral artery with respect to stroke. So, what is a stroke? There are two types of strokes. The first is an ischemic stroke, which occurs when blood clots or other particles block the blood vessels to the brain. A hemorrhagic stroke occurs when a blood vessel bursts in the brain and the blood builds up and damages the surrounding brain tissue. Where is the middle cerebral artery? The middle cerebral artery branches off the internal carotid artery. It is the larger of the two branches. The smaller branch is the anterior cerebral artery. The middle cerebral artery supplies blood to the lateral convexity of the cerebral hemisphere, which includes parts of the temporal, frontal, parietal, and occipital lobes. The middle cerebral artery is one of the three main major paired arteries of the brain and does not make up the major parts of the circle of Willis. However, it does make up areas of the circle of Willis. What are its branches? The middle cerebral artery has many branches. The lenticular striate, which affects the putamen, the caudate nucleus, and the anterior limb of the internal capsule. The orbital frontal branch affects parts of the frontal lobe, while the precentral and central branches also affect the frontal lobe. The anterior and posterior parietal branches affect the parietal lobe. The angular branch affects the angular gyrus, while the anterior, middle, posterior temporal arteries affect the temporal lobe. The posterior temporal artery also affects the lateral occipital lobe.
A middle cerebral artery stroke affects many areas of the brain. In a superficial aspect, expressive speech is affected in Broca's area. Receptive speech is affected in Wernicke's area. Movement of the head, neck, trunk, and arm in the motor cortex, and sensation of the head, neck, trunk, and arm in the sensory cortex. The structures inside the brain are affected are the caudate and putamen, making up the striatum, which receives cortical inputs relayed to the basal ganglia in charge of direct and indirect pathways for initiation and control of movement. The globus pallidus, which is the site of origin of output from the basal ganglia to the substantia nigra, also the thalamus, which is in charge of the direct pathway for initiation and control of movement in the globus pallidus. And finally, the internal capsule, which is made up of the anterior limb and the genu. The anterior limb of the internal capsule contains the corticopontine and thalamico-cortical fibers, while the genu of the internal capsule contains descending fibers of the corticobulbar tract.
What symptoms correspond to what brain areas correspond to the brain areas affected by middle cerebral artery stroke? For the left middle cerebral artery superficial division, right face and upper arm weakness do occur, and this is due to damage to the motor cortex, as well as there may be right face and arm cortical type sensory loss with respect to the stroke involving the sensory cortex. Other aspects of the left MCA superficial division are non-fluent aphasia, which is the inability to speak fluently due to damage to the Broca area, as well as fluent aphasia, impairment of the ability to understand spoken word and sentences due to damage to the Wernicke's area. As for the right MCA superficial division, it's the opposite. There's left face and arm upper motor weakness due to damage, again, to the motor cortex, as well as there may be right face and arm cortical type sensory loss due to and in with respect to the sensory cortex, as well as left hemineglect, which is the failure to be aware of objects on the left side due to damage to the non-dominant association areas. As for the left MCA lenticulostriate branch, There may be right pure upper motor hemiparesis due to damage to the basal ganglia and globus pallidus and striatum, as well as to the genu of the internal capsule on the left side. Other aspects are cortical deficits, such as aphasia, which happens when an infarct caused by the stroke extends to the cortex. The infarct is a small localized area of dead tissue resulting from the failure of blood supply. As for the right MCA lenticular striate branch, there may be left pure upper motor hemiparesis due to damage to the basal ganglia and the genu of the internal capsule on the right side, as well, again, as cortical deficits such as aphasia. There are several different types of risk factors for MCA stroke. There are two main distinctions. There's modifiable and unmodifiable. Unmodifiable risk factors include age, sex, race, and genetics. Age, the older you get, the higher the risk. And as for sex, women do have a higher risk for stroke, have a higher recurrence for stroke, and genetics, there may be a single gene disorder that leads to multi-system disorder, stroke being one of them. As for modifiable risk factors, we have hypertension, alcohol consumption, hypertension, diabetes mellitus, atrial fibrillation, and atrial cardiopathy, dyslipidemia, sedentary behavior, diet, nutrition, obesity, and metabolic syndrome. Alcohol consumption, substance abuse, and smoking, inflammation and infection, stroke triggers, and genetic factors. The three big ones in this category are hypertension, which occurs when the force of blood is too high against the artery wall, and it has an important relationship mostly for hemorrhagic stroke, which is again when the blood vessel bursts or artery bursts inside the brain. Smoking also has a very large effect on strokes of any form, all forms of stroke. In fact, smoking, just stopping smoking for 2 weeks leads to a dramatic reduction in stroke risk. And finally, the third most important modifiable risk factor is dyslipidemia, which occurs from diet and is elevated cholesterol or fat in the blood.
One of the main procedures to treat a middle cerebral artery stroke is the TMCAO, which is the transient intraluminal filament model of the middle cerebral artery occlusion. So this procedure was actually founded in 2018, and it has positive results, and basically what it does is it mechanically removes the clot from the middle cerebral artery. It is said to potentially improve them health-wise and to decrease the amount of therapy they will need post-stroke. And it is a procedure that they want many people to be moving forward to in the near future, even for any other types of arterial strokes. So this was the study done for the intensity of the leg and arm training post-stroke, basically dealing with the physical therapy that the patients went through. So there is a study of 100 plus disabled individuals with a middle cerebral artery stroke assigned to a random group, and they were all within 2 weeks post-stroke. The three categories that these individuals were divided into were emphasis on the arms, emphasis on the legs, or the control group. And the control group did the arms and legs, and they actually they were actually immobilized with a splint applying pressure, and they would focus on other types of rehabilitation. The treatment timeline for this study was 30 minutes a day, 5 days a week for 20 weeks, and they all had a basic rehab program to follow at home and stuff when they weren't in the clinic. To continue with the study, the arm rehabilitation helped with the dexterity of the hand and the fingers, and the leg rehabilitation focused on overall health and the functional status. The overall conclusion of the study showed that the patients that focus on leg or arm exercises had a better overall experience and recovery than those with a control, specifically with mobility.
Music is said to be a very powerful stimulant to the brain that can trigger multiple cognitive and emotional areas with a certain substrate. In respect to this belief, a test was run from the Department of Neurology of the Helsinki University Central Hospital using acute stroke patients. The patients had no drug or alcohol abuse history, no hearing deficits, they were right-handed, older than 75, Finnish speaking, no prior psychiatric diseases, and able to cooperate. There was a music group, a language group, and a control group with 20 patients in each. The music group listened to a minimum of 1 hour a day of music. Tests were run regarding emotion and cognition. Tests were run at a baseline, 3-month period, and 6-month period. At a baseline, the group showed no difference. After the tests were complete, the final test, it was shown that the music listening group preferred listening to strictly music, while the language group preferred audiobooks. While the language group improved, the music group improved significantly more, showing the greatest increase in mood, verbal memory, and attention out of all 3 groups. Patients who listened to music were not only less depressed, but less confused compared to patients who hadn't listened to music. They found that there was an increased brain plasticity in patients who listened to music during the recovery stage of their stroke in respect to other groups. It was noted that most stroke patients spend a vast majority of their day doing non-therapeutic activities. In order to receive the best results, the study showed that it is key to be more active in therapeutic activities during the recovery stage for stroke patients. In respect to the middle cerebral artery, that's all, folks.